It is the picture that's worth 1,000 words. It objectifies what has heretofore been invisible injuries that require an adjuster or a jury to accept on blind faith what the patient is saying. With the digital motion X-ray, you can show it to them. They can see for themselves, and it's night and day. It's very convincing because it's real. I mean, we certainly have no problem with static X-rays. All this is a series of X-rays that shows the body in motion. When you're talking about an injury that manifests itself when the body is in motion, you can't duplicate that with a static X-ray. I think it's very valuable on both ends. On both ends, valuable to the ones that do suffer real injury to get what they deserve for their injury, and also to weed out those that aren't. If the idea is getting to the truth, this helps you to get to the truth. And if the truth is there is an injury there, then a person should be compensated appropriately. If there is not an injury there, then good news for the patient, but also good news for everybody else in that you don't have to pay on a claim that where there isn't a real significant serious injury. I don't think that I'm overstating the case when I say that her having this digital motion X-ray series brought to light the legitimacy of her injury. Her big problem, like a lot of people who are involved in accidents like hers, is one of perception. There's a perception there that these people aren't hurt, or they're not hurt badly, or they're not hurt permanently. That was, in a nutshell, that was Amanda Bennett's situation. What it did for her case was it immediately launched her case from the standpoint of a minimal soft tissue cost of defense type settlement offer to essentially the policy limits for both her BI insurance. More importantly, for her, it allowed her to get the medical procedure which she needed, which without this she probably would not have gotten. Without a surgical remedy to stabilize that spine, she was at great risk. Had she been in another accident, had she taken a fall off a horse or a bicycle or something like that, she could have wound up as a C1 quadriplegic. And I don't think that's overstating the case. People that are injured, a lot of times, when there's no one else that's buying into it, they start questioning themselves. Is it me? Is it me? Maybe, do I just need to be tougher? Well, this told her, I was right all along. There was something that was going on, and this proved it. Now she's gotten the surgery that she needed to have. She's, trying to move on with her life. She's got some rehab to go, but I think it really helped her in terms of the validity in her own mind as to what was going on, as well as what we were able to do in terms of helping her with the cases.